And my question to you earlier was, well, this distinction between EMR and EHR, does it really matter? Why does it matter?
Well, it matters a great deal, largely because of cost. An electronic medical record implementation in a hospital is an extremely costly, resource-intensive endeavor that these hospitals are trying to get in due to the stimulus package and the reimbursements coming down and some of the mandates set down by Obama. Electronic health record is a much broader, less defined
More
project.
down
More down
the
the
road.
road. More down the road.
So this EMR issue is a tangible issue with a deadline that's been put on it.
It is. And many hospitals are not going to implement that because of the cost. Some of them hospitals are far ahead because they're university hospitals, they're well funded. Some of the smaller community hospitals, some of the smaller physician practices are less well funded, and it's an expensive endeavor to get them there.
But don't they supposedly all have to get there by 2014?
They are supposed to get there, but it's not mandated that they don't. They just reduce some of the reimbursements from Medicare and Medicaid. They should get there, however, because in the long term, the quality of care potentially would go up. One of the problems with getting there is that the disruption in the workflow, the way the physicians practice medicine and the nurses practice medicine along the way with the implementation of a new system, they're drastically changing the way they do business and take care of patients.
So as I might imagine, and I've seen some of this in my own healthcare experiences, they're going to be dealing with interfaces into a computer now instead of just writing things on a chart, many of them. Is that correct?
Exactly. It's changing the way they do business, which potentially could impact the quality of care that the providers give the patients.
Well, what do you mean by that? How does it doesn't just kind of result in more work for them? How does it affect me? I'm not sure as a patient.
They're used to doing things a certain way. They're used to going to certain places for information, which is the traditional patient's chart. Now they may have data in both places. They may have data in multiple systems. And if they don't change the workflow and change the way they actually practice medicine, as I mentioned earlier with the medication administration, they're not keeping track of accurate data.
Well, and that calls something to mind, is if you've got, one of the goals is to consolidate this information.
Correct.
I mean, there have to be challenges. You just mentioned one of them with workflow, of having information in multiple places. If the goal is to consolidate, it sounds like we're creating duplication, though. They're going to be writing things down, then they're going to be entering it. There must be other issues that come up with the idea of trying to consolidate into one place.
Correct. Short term, it's a challenge because of the information being in multiple places. Longer term, all the information in one place should provide a better quality of care. All the information in one place also brings up another challenge, which is security. You see that in the news all the time. And the interesting thing about hospitals, which I think a lot of people don't realize, is you have more of your personal financial information in a healthcare institution than you do your bank or another financial institution.
Really?
Yes.
How so? Is it?
You have your personal credit information there. You have you could have your credit cards, as most hospitals take credit cards as co-pays. You have your medical information there. You have all of your personal information there, your name, your address. Your whole family could be in there. Your mother's maiden name, a lot of the PCI data could be in the hospital.
So I imagine then we have this idea of a financial institution being a highly secure place, and you have people that are hired specifically for security issues, working with protecting that information. But that may not necessarily be the case in a small rural hospital somewhere.
Exactly. In fact, until most recently, the security position didn't really exist in hospitals. It was kind of an afterthought because most of the medical record or most of the patient information was contained down in the medical records department in file cabinets full of paper.
Under lock and key.
Under lock and key, the risk of accessing hundreds or thousands of patients' information was very low because it was all done manually. Now, somebody can hack into a computer system, pull out a lot of information in seconds.
I think I really have what I need for my article. I just wanted to throw out there, is there anything that we didn't touch on, something important that we missed?
Well, there's a lot of aspects to the adoption of electronic medical records. I think we've touched on some of the things that I think are important to myself and my organization.